Well, good day, and I'm Ruth Bowick, and welcome all the viewers to Healthcare for 55 Plus. Now, today my guest is Jackie Hummelbrunner. She's a speech-language pathologist here at the Lake of the Woods District Hospital. Now, this information program is thanks to Shaw Spotlight, and I'm so pleased that Shaw Spotlight has invited me to be the interviewer with a number of professionals involved in pertinent healthcare for area seniors. I will add that I'm positive that everyone viewing this show, not only seniors, will glean a great deal of wonderful information. We in the Kenora area are very fortunate in being able to boast such a great plethora of informative guests to this show. So get started. I am delighted to introduce Jackie, and she is our speech-language pathologist. Welcome, Jackie. So now I'm going to start right off with an interesting question, because this program is for seniors. So what types of concerns might a senior need a speech-language pathologist for? Because I'll be very truthful, I didn't know we had such a thing, and I didn't even know there was such a thing as a speech-language pathologist. So I'm going to be very interested, as I'm sure the seniors viewing will be. So I'm going to take
Wonderful.
it over to you now.
Well, thank you, Ruth, for the great introduction. Speech pathologists help with speech, language, and then the last word I usually switch from pathologist to swallowologist, because I find it makes sense to people. So my scope of practice, especially as it relates to seniors, is to help them with anything that is impairing their ability to communicate. So that could be understanding speech or understanding the written word. Even hearing falls within our scope of practice. We might be able to detect a hearing loss and refer on to an audiologist for proper assessment, but we also just help in techniques that help a person with hearing impairment enhance their communication or teach their communication partners around them how to best support a person that's got hearing impairment or any other communication impairments. So communication is a big bulk of the work that we can do. Common things are that if a person has sustained a stroke or a head injury or has a neurologic impairment, some type of disease, maybe it's multiple sclerosis or Parkinson's disease, their communication can be affected. So speech pathologists can help identify what is affecting their ability to communicate and then offer different treatments and interventions that can help them improve and enhance their ability to communicate. And then the last part, especially important in a hospital, is the role we play in identifying swallowing impairments. So we focus specifically on the safety of the swallow so that a person can get in the required amount of nutrition. And in a hospital setting, it's very important that we help with their strength and their healing, so nutrition plays a big role. So a speech pathologist would focus on what is hindering their ability to eat a full range of foods and make recommendations to make that easier, and then work very closely with a dietitian to balance what they're able to safely swallow with what their nutritional needs are.
Well, that's really interesting, because it's not just swallowing if you have a really bad cold. This is a lot more in depth than that. It has more to do with health than just a cold. Because you know, when you have a cold, your throat gets sore, and you really have a hard. It's all you can do to get a milkshake down, maybe.
Yeah.
And I'm really glad you mentioned that about hearing, because on this show I will have a hearing specialist. So I'm going to see how the two are going to connect. I haven't interviewed that person yet, but I'm going to be watching to see what he has to say.
Yeah.
So,
speech pathologists and audiologists actually train together in their first year of their graduate work.
At the same university and everything?
Together in the same program, and then we specialize in our second year.
Well, listen, oh my good, that's really neat. So you don't happen to know the one that's down here now?
I know him very well.
Oh, you do? Okay, then you know, Leland or something like that?
Leland.
Yes. Anyway, so that was, so now you've explained that very well. So do you do most of your work in the hospital with patients? Because do you go out into somebody's home? I don't think we covered that here.
Well, I am unique in that I do work part-time in the hospital, so I'm seeing inpatients as well as some outpatients. We have a small level of service that we can provide outpatients who are not appropriate for any other service that's available to them. And then in my afternoon, because my work at the hospital is part-time, I do currently do some home care work. So I do see patients or clients in their homes or in nursing homes.
You're talking about home care work with regard to being a speech pathologist, not like going to clean their house.
No,
okay.
Home care
Okay.
To help if they have communication or swallowing impairment.
Oh, okay, because they just kind of slipped my mind from it. Do you also do home care? Like, since you only work part-time in the hospital, I thought maybe you had another job.
Well, we call the home care part of our service. So home care can fund different services to go in, such as speech pathology, physiotherapy, occupational therapy, dietitians, as well as homemakers. So maybe it's the homemaker piece that you were thinking of. But home care, it has many more services than just that.
That's right, a raft of service that I would never have thought of, yes. Well, I'll go on to the next question. Now, how might a senior person in our community access a speech pathologist? That's access you, Jackie.
Yeah. So in a hospital, it's a medical referral. So whether you are a patient as an inpatient, or coming for our outpatient services, we require the physician to make the referral. And that is because the physician is aware of the person's overall medical status, which can be important to knowing whether or not it's appropriate to start certain interventions or assessments. So if you're coming to see me at the hospital, a medical referral is required. We screen the referrals that are coming for outpatient to make sure that there's not a more appropriate service. So for example, if you are a candidate for stroke rehab, which is a much more intense acute service, we would make sure that you were directed toward that service. If you had declined that service, then unfortunately you would not be a candidate for our service, because we are here to fill gaps, not to reduplicate a service that's already available.
Why would someone decline if they've had a stroke and they need your expertise? You mean people actually decline and say, I don't want this?
It's a little bit tricky because we are rural, remote Northern Ontario. So we don't have a stroke rehab program in Kenora. So that is where you would go for very specialized, intensive early treatment. So that's typically the first 3 months maximum after you have had a stroke. And unfortunately, Kenora residents have to go to Thunder Bay. The care they receive there is very good and very specialized, and when they have plateaued or it has been determined that they no longer need that level of intensity, they may return to Kenora at that point and get a slower stream rehab to continue some of their progress, which at that point is at a slower pace.
And that would be you.
And then that could be me.
So do you still need another referral, or they just come in from Thunder Bay?
It still needs a medical referral.
It still does then, so they have to see their doctor.
Referral.
Okay.
And yeah, so why someone might decline it is Thunder Bay is a long ways away. Yes. And in the winter, and if family is finding that difficult, I can see why patients might think that, well, I know there's a speech pathologist in Kenora, I'll just go to Kenora. But we don't provide the same level of expertise, specialization, or intensity. So it's really important to figure out ways to stick it out for that early rehab that's offered to you in a specialized setting.
Okay, well, is that because, like, when you go to Thunder Bay, you can't stay for a full week and have this speech pathologist work with you? You don't have to go up one day and come back the next. Is that the problem? Like, is it because you have to go back and forth so often you can't stay for...
No, they don't. They would stay for a period of time.
Oh, so they could stay.
They stay as an inpatient, but I think what's difficult for families to understand is that they are far away, and so if a spouse is wanting to join that person, they would have to have accommodation or something to
room
give
or friends or
and so it's an inconvenience.
And it would be
it's a factor of where we live, and that we can't have all specialized services in Kenora.
That's right, yes.
Because we don't have a population to support all of those specialties. So, but I know that a lot of the families that I've helped support to take advantage of that intense rehab have been very grateful when they returned.
So they're happy they did go.
Their progress was phenomenal.
And what
in
is it, a month or 6 weeks, or how long, or does it depend?
It depends on the assessment and what their needs are, and sort of a lot of factors go into that.
I see, okay. So here, I hate to get into this about Winnipeg and Thunder Bay, but I guess there's probably wonderful speech pathologists in Winnipeg, but we just, because of the rulings with the Ontario, medical system and the OHIP and that, you pretty much have to go to Thunder Bay.
That's our catchment area hospital, although we do refer to Winnipeg, and we're not denied service. However, it's it's sometimes harder to access Winnipeg services.
But Thunder Bay they could get in practically right away the minute you phone and say we need. Yeah, okay.
Yes, they do.
Well, that's encouraging to want to go there then. Yeah, but I can see their winters are so long too. I can see why. Oh, it's October. We're going to be November, December, January, February, snowstorms.
Well, they wouldn't be there for that many months.
No, I know, but
it's still a
whatever month you would go, you'd be running into that.
I see.
The winter, the cold weather, and the snowstorms, and the ice, and everything. Yeah, yeah.
It's part of rural living.
Are you a Kenora person, or have you come from somewhere else to be here? Is this your?
Well, I definitely have connections to the region through my husband's family, but I was born and raised in northern Saskatchewan, which is also Precambrian Shield.
Oh, yes,
the same rock, the same lakes, very similar. But I moved to Kenora from BC. I was working in Vancouver before I came
as a speech pathologist.
Yes.
Yeah. Oh, so we're lucky to have you then. Nice that your husband got transferred here because
I'm lucky to
you
be
came
here.
along.
Yeah.
Okay. Well, okay. So now, how do SLPs help with communication? But first of all, what's the acronym? SLP stands for?
Speech-Language Pathologist.
Okay. So how can you help with communication when someone comes to? Where do you start, or how do you work it? How do you do it?
So we have many different assessment tools that help us identify what the communication impairment is. So we look at what the person's goals are, and what they are telling us is what is hindering them. So it might be that they are having difficulty formulating sentences, or they are not being understood because their speech isn't strong. They're not forming the words maybe as accurately as they need to be understood in Safeway or at the library or when they're out. So we would do an assessment which helps us identify where the difficulties lie, and then we would negotiate with the patient what their priorities are, and then we would determine a treatment plan. So depending on what our assessment tells us are the areas of concern, and based on the patient's input or the client's input, we would determine different plans of intervention.
Okay. Now, would language have a problem with it? Like, I'm talking about someone that's a newcomer from another country and they're just still learning English, and then they get like that must be very difficult then to try, because they really haven't a good command of the English language, and you would probably have to do this program in English with using your English.
So
how do you work it when you've got?
I do have access for assessment purposes to interpreters, although we don't have very many languages represented in our interpreter services.
That's true,
but I have worked with interpreters before. And then I rely a great deal on family and friends who may speak the language. And we do have lots of staff in the building that speak many different languages, so I've used them as pinch hitters before as well.
You get on the microphone and holler like through the mic, I need some.
Anyone speaking Spanish or Swedish or something. So that does definitely add challenges, but it's not impossible.
Okay. Well, that is great, because I know there's, a lot of people come here and they're still learning the English language and they just don't know. And then that must make them frustrated. So you would have to deal with frustration too, wouldn't you?
A person that is having difficulty with English as a second language is not something that would be a publicly funded service, but there would be private speech pathology services if someone was frustrated with that and not being understood because they were having difficulty learning the English language. But that would not be a service that's currently funded by health.
But do we have private speech pathologists here in Kenora?
I do some private work.
You can do that as well.
There hasn't been that much demand for that type of work.
So
it's more their communication skills have been impaired by an accident, an injury, or a disease process.
Okay, and this is a personal question. I have a relative that had a stroke, and I find that her speech now is very good thanks to the speech pathologist, but it seems to me when I ask her a question, I don't know whether it takes her brain a little longer to get to her mouth and tongue, or her mouth and tongue get to her brain. Can you explain why sometimes there's a delay in her answering my question?
Okay, so stroke injury is a lack of blood supply that occurred to the brain at some point. It could be also either a lack of blood supply or an actual bleed that damaged different brain cells. Each of the brain cells that we have different functions. So some of them help us blink our eyes, or some of them are related to us being able to walk, or to understand language, to understand what's being spoken to us, or understand what we're reading. So depending where the injury was in the brain, that would impair certain functions of your speech and your language. So sometimes and I don't know the person, so it's hard to know exactly, but sometimes because you've had a brain injury, a stroke is actually an injury to the brain. It slows down the processing skills that a person might have. So they might still understand you, but it might take longer to process the information and make sense of it.
That's what I'm thinking
and then to formulate a response. I understood what you said, but now I've got to think of the words I want to put together to respond. So that's pretty normal if you've had an injury of that type. It could be, though, that she is also having difficulty comprehending. So speech pathologists refer to that as receptive language skills, receiving the language and being able to make sense of it. So sometimes people can understand if it's very common information, like stand up. They understand that. But if they start telling them something more complex, like instructions for a recipe or something like that, or how to fix their cell phone, is less
You don't have to have a brain injury to wonder how to fix your cell phone.
No, that's true. That's more complex and unfamiliar. So they may only be able to pick up on a few of those words that they understand, and they're pausing because now they've got to figure out what the other words might have meant. And that's due to the impairment that they have.
Well, you've explained this greatly for me. I really thank you. That's quite interesting. But I'm going to run on because I don't want to run out of time here because now we've talked about this swallowing. So tell me what you exactly mean by swallow safety, and why has speech and you as a pathologist have to enter into this?
Right. So actually, I wish I would have recorded myself. I was working with some University of Ottawa students yesterday.
Here in Kenora?
Yes. In some other work that I do. And we were discussing why speech pathologists are the ones who, within our scope of practice, are helping assess swallow impairment and making recommendations regarding swallow safety. And the first thing that we did was communication. So in our training, we learn in depth the anatomy and physiology and function of the lips, the cheek, the tongue, the throat. Our respiratory system is included in our training. So pretty much from the diaphragm up, including the brain and all of the functions of the anatomy, the neuroanatomy. So with all of that knowledge, all of those same muscles are used to chew the food, swallow the food, and have it enter the stomach. We don't really go beyond the stomach. We're not into digestion or things like that as far as our scope of practice. It's more the ability to eat or swallow that we're trained in. So it's all the same muscles as the talking muscles. So that helps us do that assessment and figure out, are the muscles weak? Are they working in a coordinated fashion? And are they moving the way that they're supposed to move so that we can chew and swallow our food?
Okay, well, I'm glad, because swallowing then isn't just chewing your food and swallowing it. There's a lot more involved. I didn't realize that your cheek muscles and your ears and your head and your nose and everything sort of circles around it. You think you just put food in your mouth, chew a little. You're supposed to chew a lot, and then swallow, and it just goes down nicely. But there's, as you say, from your brain to your stomach is all involved in this one thing. And how many times a day did we swallow?
Well, there's stats on that, but you caught me off guard. I don't know that number.
I really wasn't a question. I
top of my head.
No, I was just kind of
many times.
Well, I can just imagine.
Even our own saliva. So
swallowing that,
when I start working with people, they're really taken aback because it's not something we think about, and it is something that's automatic. So the way that our nervous system does it, it's automatic. We're not supposed to think about it.
No, you just do it.
But once you lose ability to swallow, unfortunately, you do have to think a great deal about it.
Oh, really?
And so a speech pathologist would help the person think about moving the muscles that are required to be able to swallow properly. And we would probably start with things that are less likely to choke a person or go down the wrong pipe, and build their strength and build safety strategies so that we can build them up to the highest level of diet that they'll be safe with. Okay,
well, I never really thought of that because it's just so interesting. Every time I do one of these sessions with a professional, I've learned so much, and I really learned now that you just don't swallow and it goes down and goes through your stomach and goes to all the parts of your body to give you nutrition. There's a whole. It's just amazing when you think of your body, isn't it? Like when you start thinking of our body and thinking of all the things from what I've learned in all these sessions, that it's just like it's a miracle we're even here. And everything's connected so well.
That's true.
Yeah, that's
very
good.
complex.
I do want to go back to, though, a little bit. Something about you can't just You can't just phone the hospital, the Lake of the Woods District Hospital, and ask to get connected to a speech, because they wouldn't know your name even, say, is there a speech pathologist here? And you say you can't do that. You have to go through your doctor first. You can't, someone like will be watching the show and think, you know, I'm really having trouble, like listening to you think, you know, I'm having some of those problems. I'm going to phone the hospital and see if I can't talk to that. You can't do that.
Well, for older adults, there's 2 service streams that they might be eligible to receive speech pathology service in. And one of them is a doctor's referral to see a speech pathologist here at Lake of the Woods Hospital as an outpatient, or if you're admitted to the hospital, then it's okay. We would be seeing you as well.
It'd be automatic.
So a doctor's referral, and the doctor will give you a referral and then ask you to call our department to book an appointment. Okay. So that's one way.
Okay, I'll let you finish the other, and then I'll follow with another question quickly.
And then in Kenora, we also have speech pathology services provided through the Northwest LHIN, which that title will be changing with the changes in government.
Yes.
But through the home and home care program. So that program, if you call, you can call the Northwest LHIN, and anybody can call. The patient themselves or a family member can call that number in the Kenora phone book and say, I need an assessment by a speech pathologist, and then one will be sent to your home. So we do look at the referrals that come here, as I mentioned earlier, and we make sure that there's not a more appropriate service. And sometimes I will review the referral, and if I think, and maybe I will even call the person to see if it's a hardship to come in. If they have a disability where they are more appropriate for home care, then I'll redirect that referral to the home care program.
Okay, well, that's great then. Well, thank you so much, Jackie. This has been just an intellectual for me, because it makes me, now when I'm going to go home and have my supper, I'm going to remember when I'm swallowing, I'm moving every muscle in my body to get it down to where it's supposed to go. And so with the speech too, that's very interesting. I'm just so glad you decided to join this program, and I'm sure all the people in Kenora watching this Seniors Healthcare 55 are going to be very interested too. But I have to remember, just mention one quick thing, that if the person has this really speech problem, it would have to be a family member phoning in. You could hardly get on the phone yourself and try to,
depending how severe the communication problem is.
Yeah.
Sure.
Okay, then yes, because let's hope everybody has some help, even if it's a neighbor. Yeah. So thank you again, Jackie. This has been wonderful. And I shall return with another segment shortly. Thank you so much. Goodbye.